Let's talk about sciatic pain today. And I want to start off by saying sciatic pain means something different to a lot of people. And sciatic pain can be initiated by more than one problem. Okay? Let's talk about where the sciatic nerve is and what it does before we move on. Okay? We're going to start by drawing a picture. We're going to have the last three vertebrae of the lumbar spine. So we have three vertebrae here, and then we have the sacrum, we have pelvic, and then we have legs coming off there. You got to remember that in each of these areas there's a disc in this disc space, like that. Okay? The actual sciatic nerve is made up of 5 nerve roots: S2, S1, L5, L4, and part of L3. Okay? That sciatic nerve goes down the back of the leg to the knee. And then from the knee, it does everything. It goes all the way around down to the big toe. We can identify where the actual problem in that nerve root chain is based on where someone feels the symptom. Let's say someone feels the symptom on the front of their shin. Okay? Right there is a very specific dermatome region. And we can say that based on that region, we can trace that nerve back to either L4 or L5, and that's where we're going to find the lesion that's causing the nerve root to be irritated, and then you feel that symptom in the leg itself. So we can do that anywhere along this chain, anywhere along that nerve root, and we can identify exactly or pretty close to where the actual problem is. If you have leg pain that goes just to the knee, that pain can be also initiated by a sprain or strain of the sacroiliac joint. It's the joint between the sacrum and the half of your pelvis called the ilium. And there's a huge ligament there called the sacrotuberous ligament. And sometimes when the ilium gets subluxated or fixated and it stops moving properly, you can have a referred pain that seems like it's sciatic pain, but it's actually not. The other thing that can cause sciatic pain is a disc herniation. You can have a disc get injured, and that will bulge and sometimes cause pressure directly on the nerve root, and that can cause nerve root pain or pain that will go down the sciatic nerve somewhere in the leg. Sometimes a tumor can cause a similar thing. You can have a tumor somewhere along there, which is very rare, but it is a possibility. Another thing that will cause that, sometimes you can sprain your lumbar spine. If you lifted something or you twisted your back and it sort of got sprained and begins to swell, just like a sprained knee or sprained ankle will puff up and get swollen, these joints will do the same thing, and that can actually in effect cause a sciatic pain due to a swelling or inflammation in the area, which will cause nerve root pain or nerve root compromise, and then you'll feel that symptom in your leg. But most of the time, if your lumbar spine shifts one way or the other and it gets stuck, that can cause nerve root pressure. That will then cause nerve root irritation, and then that will cause a sciatic pain that you feel the symptom of in your leg. One of the things that chiropractic can do is resolve that very quickly and easily, and it's something that I enjoy very much as a chiropractor, because giving someone relief from sciatic pain is usually a life-changing event. It's a big deal to them because they're often suffering a lot of pain and daily lifestyle changes.